Today I want to talk about one of my favorite lipedema conspiracy theories. Stay tuned. For diseases like lipedema that are a little bit difficult to understand, we don't exactly know what causes it and we don't exactly know how to prevent it from coming back in the future. The best answer that we have at this point is doing liposuction, which seems to have the most protective effect of keeping lipedema off. When we're dealing with challenging things like this, I think for me and for my patients, it's helpful to have a framework on how to educate them to better understand the disease. One of the things I like to repeat to my patients is one of my favorite conspiracy theories. So this is not a proven thing. It's just kind of how I internalize and think about lipedema and help patients understand the way that I think about it. So when you think about your body, it's constantly recovering and reproducing cells. So cells are dying, new cells are being made, your hair is growing, all these things are happening without you even understanding what's going on. The thing that's interesting is that the person that you are today is not the person, literally not the person that you were a year ago. You've replaced all your cells and kind of gone through everything. The thing that I think is really interesting is when you look at people with tattoos. So tattoos are foreign pigment that's deposited in your body, and the reason that it stays around is because your body can't chew it up and break it down, so the tattoo remains. And while they may fade over time, they don't really go away. In the same way, as your body is changing, you're getting new cells, lipedema fat doesn't seem to really go away. So I think of it like a tattoo on the fat. So in the same way, if you wanted to get a tattoo removal, there's a couple ways that you can do it. One would be that you can use a tattoo removal laser, and what that does is it shoots laser into the tattoo and it causes the large fragments of pigment that your body can't chew up and absorb to break into smaller fragments that your body can then chew up and digest and get rid of, and that's how the tattoo gets ultimately removed. I think of liposuction for lipedema in a similar way, because for whatever reason, there's some fat that's stored in your cells that your body can't get rid of. You can't exercise your way out of it, you can't diet your way out of it. The only thing that really seems to remove this unwanted fat is doing liposuction. So in the same way that your body can't process and get rid of a tattoo when you have those, for people with lipedema, they can't also process and break down that fat the same way that someone without lipedema can do. So by going in and doing liposuction, you are physically extracting whatever is in those fat cells that's preventing weight loss or that's causing the irritation and inflammation. So in the same way as people that have tattoos, they don't get rid of their tattoos as they age, and people don't get rid of their lipedema as they age, it tends to get worse. I think this is a helpful way for thinking about it. It's a way to explain to my patients why we have to do liposuction to get this crud out of there, because otherwise your body just can't seem to process it. I hope that this was helpful. It's not really a true conspiracy theory. It's just kind of like a helpful way to think about things. I think with weird diseases like this, it's helpful to have a couple different mental models to kind of understand and work through things, especially for patients. Some come in and they've got a lot of understanding about lipedema and they've done all the research, and some really are just kind of at the beginning of their journey. So if you're at the beginning of your journey and you're trying to understand lipedema, I think understanding that you can't process that fat the same way as someone can't process a tattoo and get rid of it is kind of helpful way to think about it, and that helps people come around to understanding that liposuction is really the best way to treat it and remove this unwanted fat. If you found this video helpful, please consider watching some of our other videos. We've got a lot of helpful information about lipedema out there. I try to be very transparent about the way that I think about things in hopes that you get the education that you need so that you better understand this disease that you're dealing with.